My name is Nicole McNelis. I'm a licensed professional counselor and a certified perinatal maternal mental health specialist. I live and work in the Philadelphia area, and I'm also a mom of two. I have a private practice where I specialize in perinatal mental health, and I'm also a counselor educator. I do continuing education, presentations, writing, essentially anything and all things motherhood. Recently, one of my specializations is maternal rage. The discussion in popular culture has really changed around maternal rage, and there was a need for education for therapists and for other professionals who provide care to the maternal population. That is what I do in a nutshell.
What drew you to working with the perinatal population?
That story for me starts around 12 years ago, around the time that my first child was born. I was really fortunate that I had a very pleasant and comfortable pregnancy. My assumption was that I was going to go into the postpartum period the same way. And that was not what the postpartum period had in store for me. I experienced fairly severe postpartum depression with my first child. I live in the greater Philadelphia area, barely an hour outside of the city. There are plenty of therapists in this area. At that time, 12 years ago, I struggled to find a therapist that was a good fit for me that also specialized in perinatal mental health because I knew from working in the mental health community that I needed a specialist. Finding both a specialist and somebody that was a good fit for me, that was compassionate, felt impossible at the time. It was a real struggle. Thankfully, I was able to find a postpartum adjustment support group that was local, run by the most wonderful nurse and social worker. They met once a month, and that group truly was a lifeline for me. And still to this day, 12 years later, thankful for that group. During that time, I was somebody with resources. I was somebody who understood this community. I was somebody who knows how to navigate the mental health care system. And I still struggled to find the help and support I needed professionally. I realized when I went back to doing outpatient work that my interests had shifted, honestly, that my heart had shifted because of my lived experience. The work I did best was with moms and families. And so I really shifted my specialization. I think back to that group that was such a lifeline for me. That support group meant everything to me that entire first year of my son's life. And I really thought if I could provide just a little bit of the support that group provided for me, that will be the greatest accomplishment professionally. And then that's when I started looking into the trainings, getting my certification, and moving into the perinatal space professionally with lived experience that brought me here. And I'm so thankful for that group. And I'm so thankful that I can bring just a little bit of that support that I received to the clients that I work with, and hopefully to the therapists that I work with when I do continuing education and consultation. That was truly a meaningful and life-changing experience for me.
Since you mentioned maternal rage, you speak about why it is getting more attention right now.
Yeah, I can absolutely speak to that. In terms of why maternal rage is really coming to the forefront in cultural discussions and social media, I really saw a turn during the pandemic. It was such a change from what families had experienced previously. All of a sudden, in most households, everybody was back home. All of that labor, for the most part, was on mothers. And there was this sense of overwhelm and overstimulation and also fear and anxiety. I think we forget, even though it was only 5 years ago, just how scary that time was. And when you have all those things combined, including a sense of powerlessness, nobody really knew what to do and how to protect their families. All of those feelings lead to feelings of rage, and specifically maternal rage, because a lot of that labor was placed on mothers, the schooling, the paid work, the household work. And when you combine all of those together, you get this boiling over, you get this rage. And around that time, the conversation around mental health in general was changing because we were at such a crisis point, and maternal rage was part of that. There were suddenly articles in major publications covering maternal rage because we were experiencing it more, it was being covered more, and it became a part of the larger conversation, and that showed up in the therapy room. It showed up in consultations with colleagues, and honestly, it showed up in my house. That was another big piece of it. The pandemic was such an odd time for therapists. What we were experiencing personally was also showing up for us professionally, and that was really an awakening for me in terms of maternal rage. That's one of the reasons why it became so much more part of the conversation during that time. It was more prevalent and we were more open to talking about it.
What inspired you to create this course?
What inspired me to create this course was twofold. I was noticing that maternal rage was coming up much more frequently in my sessions, especially during the height of the pandemic. And even though they had an inkling that they weren't alone because they were hearing a little bit more about it on social media and had a name for it, there was still some anxiety around bringing that up in the therapy room, even in a relationship where there was therapeutic rapport and a therapeutic alliance. There's so much guilt and shame around maternal rage. So when clients felt comfortable enough to open up to me and talk about it, I wanted to give them resources and interventions. Validation is so important, and that's a critical foundational piece to the work that we do as therapists. But I knew I needed to go beyond that to really help clients manage maternal rage. So I started to dig into the literature, both academic and what was in the popular culture, and really looking at what evidence-based interventions and resources can I put together for clients. And that was where this course started. Then the other piece of it was I do consultation with colleagues, and maternal rage was coming up in consultation all of the time. And I felt I want to be able to give resources to my colleagues also. I want to be able to talk to my colleagues about evidence based interventions. I started to put this body of work together. And then I realized, wait, there's probably more therapists that want to know about this. I know my clients and the therapists that I was working with are eager to learn about it. And that was the genesis of the course. I thought, let me put this together in a way that's super useful to therapists.
What's a misconception about maternal rage that you wish more folks understood?
There's two really big misconceptions about maternal rage that come up all the time. The first one is that maternal rage is a personal failing, and the second one is that maternal rage makes you a bad mother. Both of those are misconceptions, and neither one of those is true. Maternal rage is an emotion, and it's an emotion that happens in response to what is going on in your environment. And it is absolutely manageable and it's understandable. And it's actually a rational response to what is happening. Those misconceptions come up all the time and are honestly part of the reason that mothers really struggle with talking about maternal rage because they're afraid that they're going to be judged and that people are going to think that they're a bad mom or that they've failed.
How does it typically show up in the therapy space?
One of the most profound ways that it has been described to me by clients is that it feels like both drowning and exploding at the same time. And when I heard that, there's moments in the therapy room, even for me, as long as I've been doing this for over a decade, that take your breath away, where you realize, whoa, that really hit me. When I heard that, this feels like drowning and exploding at the same time. I thought, there it is. That is my client experience of maternal rage. They feel so completely overwhelmed that they cannot deal with the next thing that's coming. And also, there's such a buildup that there's this need for release, and it frequently comes out as maternal rage. That is how it's described to me as exploding and drowning at the same time. So that is how it presents and frequently comes out in the therapy room when clients are comfortable enough talking about it. They talk about the guilt and shame that comes with it. They preface that conversation with, please don't think I'm a bad mom. I'm afraid to talk about this, right? This is embarrassing to talk about. This is hard to talk about. I feel so bad. There's a lot of negative self talk that presents. And when we can move past that in a healthy way, then we can get somewhere with managing the maternal rage.
What is the most common question that you get from other therapists about maternal rage?
With colleagues, there's two questions that come up frequently. The first one is, what causes maternal rage? Where does this come from? And what distinguishes maternal rage from other kinds of rage? And the other question is, what do we do with it? What are some effective interventions that we can use with maternal rage? And those I address in the course. When I put together this course, I really thought about the participant experience. I know that my time is so precious and so limited, and that my life is so full. And the participants investing their time in this course feel the same way. And I want them to feel like this was a good use of my time. I'm understanding this topic, but now I also have interventions that I can use with clients the minute that I walk out of here. That was critically important to me, and that's absolutely built into the course.
What makes this course on maternal rage unique?
There's a few things that make this course unique. The first thing is we take a two-pronged approach to looking at the issue of maternal rage. We look at individual interventions that can help individuals manage what they're experiencing. But we also look at what's happening systemically, because that makes a really big difference when we're talking about something like maternal rage, which is a reaction to what's happening in the environment. So that sets up this unique framework. It's evidence-based, but experience-wise, when I talk to clients about not only what's happening for them individually, but also how their environment is impacting them and where this emotion is really coming from, that in and of itself is an intervention. The relief that they feel is unreal when they have this understanding that, wait, this isn't just me. This is me reacting to my environment. And that's something really important to take into consideration. The other thing that sets this course apart is I work really hard to make sure, again, that this is worth the participants' time. I try to keep it really engaging, interactive, and practical. I want participants walking away with a toolkit that they feel they can use immediately in the work they do with clients. That's critically important to me.
What will therapists remember most or take away with them from this course?
I think there's a number of things that therapists take away from this course. The feedback that I typically get from therapists is that they feel truly seen and understood when they're taking this course. They feel like me as a facilitator really gets where they're coming from and what they're wanting to get out of this course. What they're wanting to get out of this course is I want this to be engaging. I want to be interested in this. And I need to walk away with things that I can actually use with my clients. The theory is great, and we touch on that, but what I really need is interventions. What I really need are skills and strategies that I can teach my clients so that they can manage maternal rage in a healthier way. So that's something that's really huge that therapists walk away from this course with. The other piece of it, and this is feedback that I get from therapists, is it's really enjoyable. We take a topic that is really heavy and that can be really hard to talk about. And I think this is because of the community that we create in the course. We find joy in it that comes from this sense of understanding and recognizing, hey, we're working together on this and we're in this together. I value the participants' time so deeply. I am not about wasting anyone's time. This course in particular is 2 hours. The fact that they're taking 2 hours out of their very full and busy lives to say, this is something that matters to me as a clinician. This is something that matters to my client. I'm going to take time away from my very busy life and invest it in this course. I take that responsibility so seriously and show up with everything that I am. I have that participant experience at the top of my mind, and I try to keep it fun, engaging, and really practical and useful. The way it's been described by therapists who've taken this course is it feels like an experience. It feels like an event. That's the best feedback that I could get.